I wanted to take the time, since we've had so many informative talks in the area of mood disorders, to bring in mood disorders from a child's perspective. And this was really for a number of reasons. The first one, and I think probably one of the most important ones, being that when it comes to mental health issues, I think children are very commonly overlooked. I think that it's quite difficult for us as adults sometimes to realize that children can present with mental health problems that in some ways are very similar to our own, because we often like to think or have this conception of children as these wonderful, free, easy living little beings. And unfortunately, particularly nowadays, it seems that that is just not the case. And this is possibly for a number of reasons. But one of the things that I think is most pertinent when it comes to looking at children in terms of having mental health issues is that for anyone who's had a mood disorder, for any adult who's had a mood disorder, you will know that mood disorders don't happen to individuals. Very commonly they happen to families. That when you have a family member or a loved one with a mood disorder, that their experience of that mood disorder will impact upon those around them and those who care for them. And that is no different to the children in the family. So not only do children in the family have a strong genetic risk, as Dr. Lunt has highlighted, when it comes to having a parent or another family member who have a mood disorder, but quite often there is a home situation or environment which is created which can exacerbate the chances of a child presenting with some kind of mental health difficulty. A recent World Mental Health Bulletin has highlighted that the age group that has the highest rising rate of suicide, completed suicide, so suicides that have gone on to kill the person, not just suicide attempts, is in our 10 to 14-year-old age group, which is really, really frightening and concerning. This health bulletin also highlighted that the leading cause of mental health difficulties in children at the moment is anxiety. So that's why I've chosen to look a little bit at anxiety today. To first of all look at what might be some of the common triggers or causes of anxiety in children, to look at signs that you can look out for children in distress who may be anxious, and then to look at, well, what is the plan of action? Where can you go if you have seen that a child might be in distress? I think another important reason for me to talk about this today is particularly anxious children are very commonly misdiagnosed. And when we look at the signs and symptoms of anxiety in children, we might get a clearer understanding as to why that is. And commonly children who are anxious are thought to have ADHD, that they're labeled as children who have ADHD, or children who have behavioral problems and are treated as children who are behavioral problems. Or they might be medicated for sleep disorders, where in actual fact the root cause of some of those issues is actually a psychological cause, being anxiety. So I think it's really important to have a little bit more of an understanding of how a child might present if they're in distress. And just to come back to what Dr. Lang said earlier about the different types of anxiety, that is no different in children. In children, we do have different types of anxiety. One of the most common, of course, being separation anxiety disorder, which is probably one of the easiest to spot. But children are also affected by post-traumatic stress disorder, obsessive-compulsive disorders, phobias, as well as generalized anxiety. Generalized anxiety is the most common form of anxiety affecting children, and that's what I'm going to focus on today, because the other forms of anxiety have very particular causes and symptoms related to them. So let's look at what are some common triggers or causes that might contribute to a child becoming anxious. Of course, bearing in mind that children who have a biological history or a family history of some kind of mood disorder might be predisposed to being either anxious or depressed. But when it